for the most part. All right, item number 4.03, a COVID update. Dr. Stegall. Did you enjoy Texas?
I did.
Hmm.
Nice warm weather. It's a great time.
You brought some back with you for a little while.
I know, right? Yeah. All right. There we go. All right, our COVID update. So I have lots of information for you, so I'm going to take this mask off so you can hear me clearly. As I go through this, if you have any questions, don't hesitate to stop me and ask questions, because I'm going to review the new CDC guidance along with the VDH recommendations from that guidance. It's quite detailed, so we'll get through it the quickest we can. So just our typical data update. As you can see, the state of Virginia is back to all red, high transmission. This is the most updated information for Roanoke County. We're at a 27.1 positivity rate. Last month when I reported to you, we were at 9.3. And last month we had 277 cases. Today, for the last 7-day average, we're at 626, more than double since the last time I reported to you. Cases, this one I'm just showing you the picture because you can see this is from the very beginning of the pandemic on the far left. You see where we're at of new cases per 100,000, much higher than we have been throughout the entire pandemic. Again, this is Roanoke County data. Percent of PCR tests, just as a visual, showing the same thing, starting from March, going all the way to the current date, much higher percentage than we've been throughout the whole pandemic. Took a look at the vaccination rates to see if they've changed any. They've increased just a little bit. We're at 28% for the younger age group. We were at 24, 25. So all these have come up just a little bit. You can see 10 through 15, we're up to 60%, and 16 to 17, we jumped up to 64.5. Not a huge difference, but since last month, there's been an increase in youth vaccination. So I want to take a look at, just to give you an idea of where we're at for this school year, starting in August. This is the total number of positive cases by month. So you can see the number of cases by month for staff. The total there, we're showing 144 through those months. If you divide that by the number of staff we have, that's about a 7% impact of our staff have experienced positive COVID. If you take a look at our students, those are the number of cases per month. Of course, clearly seeing September being the highest number. I've got a feeling that will change come January. But as of right now, September was our worst month. And that is at about 879. That's 7% of our student population. Monthly in-school exposure. So we've always prided ourselves on, we think that our mitigation strategies are working. We're seeing very little in-class transmission, which means we have very few classroom shutdowns. We've only shut down one school. And in those classrooms, they've been classrooms where they've been very young children, or in classrooms where they've had trouble, being able to maintain mask wearing. So I think our mitigation strategies we've done a really nice job, and I think that shows in these in-school exposures. If you take a look at staff, we've only had 9 total staff exposed in school. If you take a look at students, we've had 1,256. That's about 9% of our total population. Now, I know we want to take a look at the number of in-school exposures and how many of those tested positive. We have racked our brains trying to figure out how to pull that information for you, and it's going to be immensely time-consuming to do that. But what we can say is, the quarantines, we've been averaging between 300 and 500 people quarantined at our highest time. My guess is January, we're going to be right back up to 500, if not higher, quarantines. So I guess the most important thing we need to know is our teachers and our staff are working very hard to provide online instruction as well as maintain in-class instruction for 500 to 600 students. So that number is not coming down. So just to know that the quarantine numbers are higher because those numbers are a running number, because the kids are out 5 days, 10 days, some 15 days. And so you can only get a snapshot because it's the same kids every day, right? Because they're out for 10 to 15 days straight. So it's hard to pick out the number. We don't currently track the number of kids who are exposed in school as compared to out of school. Our quarantine list are all the kids. If they're exposed playing travel soccer, they're on our quarantine list, but they're not on our exposure list, if that makes sense. All right, so here's what we are currently required to do as a public school in the state of Virginia. School bus transportation, the CDC has a federal order that applies to all public schools and private schools that regardless of mask policy in the school, everyone has to be wearing a mask regardless of vaccination. The second thing is, on August 12th of 21, the state health commissioner put out a public health order that says that all individuals age 2 or older must wear a mask while indoors in public and private schools. Then we had state law, SB 1303, went into effect, is in effect until August 1 of 2022, unless something changes, which requires each school board to offer in-person instruction in the manner in which adheres to the maximum extent practicable to add current applicable mitigation strategies for K-12 schools to reduce the transmission of COVID-19 that have been provided by the Federal Centers of Disease Control and Prevention. So we are currently practicing all of those mitigation strategies that are practicable, and I think at this point so far, we've been able, obviously, to keep schools open and continue on with in-person learning. The next thing we have is the Virginia Department of Labor and Industry requires all K-12 school employees to wear masks while indoors during substantial and high community transmission. Clearly, we're in high transmission. We haven't been out of high or substantial transmission this entire school year. So we are bound by the DOLE that all employees in public school must wear a mask. On December 17th of 2021, the Sixth Circuit Court of Appeals allowed OSHA's vaccination and testing emergency temporary standard to move forward with lifting earlier court stay that put the ETS on hold. In response to the court's order, OSHA has initiated an aggressive implementation to enforce this schedule. Their current schedule vaccination requirements are set for January 10th of 2022, and enforcement will be delayed until February 9th of 2022. However, litigation process continues as the court's decisions have been appealed to the U.S. Supreme Court. We are currently waiting for final court ruling to move forward with a grant funded by the Virginia School Screening Testing and Assurance Program. We call it VISTA. This is a partnership between VDH and VDOE, and it provides school divisions with grant money to help support screen testing for unvaccinated staff. So what that looks like is we hire staff to help us manage this process. We allow free screen testing. It's weekly testing for unvaccinated staff, and they have to provide a negative test on a weekly basis if they're unvaccinated. So we have the MOU. We've gotten it back. It's been approved, but we have not moved forward with that MOU because we're waiting to see what happens with this law moving forward. If it does go forward, it's probably going to take us 4 to 6 weeks to get this program running. And we may be a little bit delayed hitting their adjusted timelines, but we won't be far off.
Can you go back to
Yeah.
that? Doesn't the bottom partnership between VDH and VDOE provides grants for school divisions to support weekly screen testing for unvaccinated staff? Doesn't that seem a little hypocritical? Why wouldn't you test for vaccinated staff?
Well, you can.
We all get it now.
You can. So the screen system, the screen testing that this grant provides, we can screen students, we can screen staff, we can screen anybody we want to. So you can. Once we're into the system, it does allow us to screen whatever population we want.
So we can change that from testing for unvaccinated staff. Let's just test everybody, if that's
You
the case.
can.
Yeah.
Why not?
You can.
So this is the,
Voluntarily.
May I? So my understanding, and maybe you can correct me if I'm wrong, is that that VISTA program was set up in place for those who did not want to take the vaccine. So that's a background. So if you have more than 100 people who are working for you, some people are going to exempt themselves out of it, religious exemption or medical exemption. And so that provides a way for those people to then continue to work.
Yeah. Yes.
So outside of,
Without the individual who owns the company having to pay for it, which you can imagine would be extremely expensive.
sure, so these people that don't, they still have that choice. So really, that's all that's speaking to then.
Yeah, we can manipulate however we want to, but when we had the discussion, it was gonna cost us $14,000 a week to test our employees who currently are not, we project are not vaccinated. Because we don't have that number yet, but that's what our project, we're at 80% vaccination rate, so we can kind of calculate it that way. It would cost us $14,000 a week to test those employees. So that's why we put the
Those
MOU
employees,
forward.
those unvaccinated?
Unvaccinated employees.
Okay.
So they can continue to work. But to
Right.
your point, we know vaccines are not stopping the spread. So
Yeah, I guess that's what I'm saying.
Yeah, and all this does, and everything you're saying is exactly right. All this does is would put us in compliance with the OSHA standard if it goes into effect.
To get the grant.
Right.
Right, the grant that we got puts us in a position where we can be in compliance. as we
How-
move forward.
You say $14,000? I mean, that was half the answer, but how much is the grant?
The testing's free, so what they do, they connect us with the vendor. It's the same vendor that runs Walgreens testing, so it's a very reputable company. And we hire 3 employees that come in and work for us. And so what it would basically look like is we would set up time maybe here at Central, because it's a central location. And employees would come in before work, after work, that staff would be here along with the vendor. They would give those tests, the results come back, they send notification, we just keep track of that information that every week they're tested.
And they are employed by us?
Yeah, yes, we will,
Okay.
yeah, we would use the grant money to hire them.
Grant money, okay.
let's hope it doesn't come to that.
We'd like to avoid doing anything
Yeah,
like this.
yeah.
But, yeah, to your question, Mr. Ray, so the only reason we had looked into what it would cost us if we had to pay for it was because originally the state was saying, oh, you can only access those funds if you're doing screening of students, which is not something we were wanting to do. That's one of the reasons we started looking into what it would cost us if we had to bear that cost. But then they changed the rules and said, no, you don't have to do that in order to access the grant. So at this point, it won't cost us anything. We'll keep you posted.
Yeah. All right, so the new VDH isolation and quarantine interim guidance that came out December 30th of 2021. The new guidance is contingent upon universal mask wearing within the school. So right out of the gate, all this guidance is contingent on that fact. But if you, basically the way this rolls out, and there's a lot of scenarios in here and it gets very muddy very quick. But a lot of people like to think that it's moving the 10-day quarantine to a 5-day period, and there is no period there. There's lots of commas there. So that's what I'm going to go through now. So if you're positive, you've tested positive for COVID, instead of the 10 days, you have a 5-day. As long as you have no symptoms and your symptoms are better, meaning that the respiratory piece of your symptoms have cleared up. That does not mean taste and smell. It just means the respiratory type symptoms. And you wear a mask around others for the next 5 days of isolation. So those 2 things have to be there for you to return after you've tested positive. If you have a fever, of course, you've got to stay home until you're fever-free for 24 hours without medicine. So here, I'm going to go through a whole bunch of other recommendations that VDH provided. Just know that CDC always comes out with school guidance. CDC has not done that yet, therefore VDH stepped in and has sent interim school guidance, and this is what I'm sharing. But all across their document, they say, this is our recommendation until the CDC provides their interim guidance. So it's possible that these can change at any time. The new guidance applies to K-12 setting when all individuals can properly and consistently mask for an additional 5 days after the end of the 5-day isolation and quarantine period, which we can certainly allow for that. The isolation, which means people who have confirmed COVID. If the individual is unable to consistently or correctly wear a mask, for example, very young children, developmental issues, we would recommend that they do a 10-day quarantine, not the 5-day. So that will be to something that we will make that decision between our school nurses, our principals, and administration here. So that will be on a case-by-case situation. Based on the information provided by the CDC, a person is considered to be infectious on days 6 through 10 of the isolation period. That's the reason they're enforcing strict mask use for days 6 through 10. However, if you think about it, there's always a weekend between the 10 days, right? So you're quarantined for 5 days at home. You come back on the 6th day, you're supposed to wear a mask. There's 2 days of a weekend. That really means you're only wearing a mask for 3 days. So those people who have tested positive can return on the 6th day, will have to wear a mask for at least 3 days, and then as long as they're not symptomatic and meet that criteria. According to the CDC, the majority of the COVID-19 transmission occurs early in the course of the illness, generally 1 to 2 days prior to symptoms, and then 2 to 3 days after symptoms. That's where they're coming down with the 5 days. So that's their justification for that 5-day isolation period. If you have been exposed to someone with COVID-19, the updated requirements for quarantine. This is if you've been exposed. You don't have it, but you've been exposed to a positive person. This is where it gets tricky with all the little details. If you are unvaccinated or you have not received your booster. So what that means is more than 6 months past your booster, because you get 6 months with that booster or 6 months with that vaccination. If you're more than that 6 months, then you should quarantine for 5 days as long as you do not have any symptoms within that time, and then you must wear the mask for 5 days after. So if you're unvaccinated, have not gotten your booster, you have to quarantine for 5 days and wear a mask for 5 days. If you have received your booster shot or received your second dose within the last 6 months, and then it shows some particulars here talking about J&J dose within the last 2 months, you do not need to quarantine following an exposure, but you should wear a mask for 10 days as a precaution. So this is when we typically say if you've been vaccinated, you don't have to quarantine. There's some stipulations added to that. If you've been vaccinated and are within the time frame no more than 6 months or 2 months after the J&J, it has to be the booster, you don't have to quarantine. So that has changed a little bit. So people who, if you're past your 6 months after your second shot and you haven't received the booster, you do not qualify for exempt of quarantine. Okay, for quarantine, these are people who have been exposed. If an individual is unvaccinated and has not received the recommended booster, and they are unable to correctly wear a mask, they will be quarantined for 10 days. Again, that will be a decision that we will make together. Children who are in days 6 through 10, period, after isolation or quarantine, should ideally be 6 feet away from others during meals, snacks, and other unmasked period. That causes a little concern for us because we're doing our best during lunchtime to keep our kids at 6 feet when they're unmasked. However, we all know that's a difficult thing to do. So, our schools, the principals already know this. They're thinking through the best way to maximize that 6 feet, or making sure that as soon as students quit eating, they put the mask back on to help prevent any type of transmission. To ensure confidentiality, the health department recommends that all students maintain 6 feet of distance between each other during unmasked periods. If a child with COVID is in the 6 to 10 day isolation period and they spend greater than 15 minutes unmasked, less than 6 feet from others, then the other individuals are considered a close contact. However, you'll see here in a few minutes, we are not going to contact trace days 6 through 10. We're not going to do that. So you'll see in another slide where that recommendation is made. Individuals can participate in sports as long as they adhere to the strict mask usage on days 6 through 10, including during play. This one's a little, I'm not really sure how this one would play out because currently when our kids are on the floor playing, they're not required to wear masks. So this would self-identify students if they're wearing masks. Of course, it could be an optional use, but that is a recommendation. I struggle with that one a little bit. But it says basically if they can't wear that mask, then they should isolate for 10 days and not participate. Schools and families should be aware that team sports and other extracurricular activities, especially indoor activities involving shouting and singing, increase the risk of transmission, of course, during day 6 through 10. They currently recommend that individuals that come into contact with someone under the isolation of days 6 through 10 not be considered a close contact, as long as both people were correctly wearing masks. So from day 6 to 10, we are not going to contact trace because we currently have a mask mandate in schools. As long as they were wearing their masks and they were on day 6 through 10 and had close contact, we are not contact tracing because that is the recommendation. The VDH says that they recognize transmission is possible on day 6 through 10, especially without proper mask use, but that we must balance the ability to perform contact tracing with the exposures that are at the highest risk. Basically what they're coming to full realization of is we have to set limits on how much contact tracing we can do because we're maximized. We are maximized, they are maximized. So it's an effort to kind of help relieve that pressure. Previous VDH guidance stated that unvaccinated children who test positive for COVID within the last 90 days. This is that thing where we said if you've had COVID within the last 90 days, you're considered you don't have to quarantine because you still have enough antibodies. So CDC has not come out with direction on that yet. So as of now, we are still allowing that to happen within the 90-day time period. They do not need to quarantine. Early data indicates that prior infection to COVID-19 may not provide immunity against Omicron variant. Therefore, it is unclear if the 90-day exemption for quarantine is still applicable from unvaccinated individuals. So currently, CDC has not responded on this one, so the health department is recommending that we still follow the 90-day. However, it may change. Okay, CDC and VDH do not recommend requiring a negative COVID-19 test in order for unvaccinated students or staff to return to school. So we did have that in place where on day 5 you could test, and then on day 7 or 8 you could return. So now they're recommending that we don't test. There is a place in here that says they recommend that you do test, but they recommend that we don't require testing to return to school and return to work. But there is a recommendation that you go get tested if you feel that you have come in contact with COVID.
To ask a quick question, I don't mean to get you off your pace here, but how does that, do you know off the top of your head, I don't want to put you on the spot, how that would jive with the whole test to stay pilot that they're starting?
So the test to stay is a screening system. So what that does is if you've come in contact with somebody who's positive, you can elect with parent permission to test to stay in school. So what they do is they test you on a regular basis, and as long as you continue to test negative, you stay in school. Okay. So it's an election basis by parent that says, I want to keep my child in school, and we're going to agree to do this testing. It's really screening is what it is. Yeah. Okay, individuals who have a fever, of course, should stay at home for 24 hours until the fever without medicine. And then they should, of course, wear a mask for 5 additional days for a total of 10 days. Okay, so the VDH is working quickly to incorporate the new CDC isolation and quarantine guidance into the test to stay. This is what Dr. Nice was talking to. They do have schools in the state of Virginia who are piloting this. And so they're discussing the feasibility and benefits of proceeding with this plan. Really what it is that they contact trace. If you've been identified as a potential contact, then you can elect to go into this test to stay program. And you can elect to stay in school along with, as long as you're not symptomatic, you agree to test. As soon as you become symptomatic, you have to go out for quarantine.
Do we provide that agree to test?
It is a permission form that the parent would have to sign.
And so they would test in the school?
Uh-huh.
Okay.
And it's very similar to the screening process with the VISTA. So they're probably using the same vendor, and if we were to do this, we could use the same vendor we have in place. That's the whole point of those vendors, is to screen test. Like, remember we talked about we could screen test our athletes, or we could screen test a group of individuals if we wanted to. That's what they're doing here. They're just letting parents, if you've been, like the nurse will call and say your child's been in contact with somebody with COVID, they're going to have to quarantine for 5 days, the new rule. Or you can test. If you test negative, you have no symptoms, you can come back tomorrow, because it's a 15-minute test. And then if it's negative, you come back. So parents would agree to do that. So that's the test to stay.
I just wanted to make sure that they weren't having to pay for that
No.
because, you know, the access for lower income.
Yeah,
Well-
it's associated with this VISTA program.
Okay.
On the other hand, with that, I mean, and not to sound negative, but I mean, I think there's a real concern with some of these ideas and pilots. I mean, you know, it all depends on the availability of tests, right? And I think that's becoming, you know, still an issue. I mean, are they available? And because, you know, I'm not sure it's a magic bullet. I don't know.
No, but
We had some of these tests to give out, and we gave all of ours out, and they also have a very quick deadline expiration date on them. And so we called to ask for more to have them here, but when we returned to school, and they told us that they had met their limit, they could not send us anymore. Our original understanding was you just reorder and we'll send them to you, so they're already in a backlog, and that was right out of the gate, so.
The accuracy percentage on those, and it may be too early to tell, but I thought I saw somewhere they're only in the 80%, 84% accurate.
Mhm.
If you have symptoms, they're 80% accurate.
If you don't, they're more accurate if you're symptomatic and less accurate if you're asymptomatic.
Yeah,
But that's what people, this is what people are buying in the stores as well.
Mm-hmm.
yeah. Dr. Lewinsky just came out and made a statement about testing and how you shouldn't be testing unless you're symptomatic because
Right.
they were having so many false positives, is my understanding.
That's right.
Like an exceptional amount of false
Mhm.
positives.
That's right. Yeah. Okay. All right, moving forward. So, using the new isolation and quarantine guidance, which we have implemented this because when we reviewed the guidance, we all discussed it and thought, well, let's go ahead and put this in place because that will get people back quicker that were currently on the 10-day quarantine. We can get them back in 5 days. We can get our staff back. We can get our students back. So we have already implemented this. Our nurses did an amazing job. Everybody who was on the quarantine list, they had to make contact with them, adjust all their dates, tell them when they could return to school. So we are currently following this new guidance. And what we're going to do to move forward is we're going to start collecting more data because we've heard you clearly that you want us to show you the number of people who are quarantined and how many of them test positive. And how many are in school and how many are out of school contacts. So we're going to keep that data for you. So we're starting that already so we can have better data for you. So that is what we're going to do moving forward. And just as additional information, if universal masking is made optional, the VDH isolation and quarantine guidance calls for longer isolation and quarantine periods. The reason for that is they put in all these 3 feet with no mask, 3 feet as long as students have masks. They put that in there to help schools get back to face-to-face instruction. If we don't have masks, then that goes away. So also we have that, so it goes back to a longer quarantine, longer isolation periods, and it goes back to the 6 feet of contact tracing. Currently we're at the 3 feet because we're wearing masks. So just know if universal masking goes away, the recommendation from the VDH, all those contact tracing, that goes from 3 feet to 6 feet, and then the quarantine and isolation times extend. So that's that would be their recommendation if we were to do that. So that's all the information I have there. Any questions you have? That was a lot.
I've got one. How do you know what the percentage of vaccinations are amongst our students?
So the health department keeps that record, and they have it broken down by Roanoke, and they do it by zip code, I'm assuming, because Salem picked up some of our kids and vice versa, but they keep it through zip code. And they provide that to us. Actually, you can find it on the VDH website under the dashboard, and you go under vaccinations and hit demographics, and it breaks it down by locality.
It's like 24153 could include the Roanoke County.
Which is close to the 24018.
Right. Well, same thing, 24012, that's mostly city, but also some county. So,
Yeah.
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 So we're right around, for middle school, high school, 61-62% vaccination.
Ms. Facciani?
Regarding the contact tracing, I know you have said it's difficult to go back to look at the contact tracing. I just kind of find it hard to believe that we didn't establish a data set to look at that. I mean, that would have been very valuable information to have. The students that are sent home to quarantine because of an exposure, what percentage of those students are coming back or can't come back because they actually test, they have COVID, confirmed COVID with symptoms.
Because we can still do it now, but I'm just going to be very apparent, it's not going to be accurate. Because here's what happens. You might be quarantined and we might send you home and you're on our list, but lots of times when nurses call and they're contact tracing, they'll say, do you know if your child's been exposed to anybody who has COVID? Well, yeah, my uncle who I saw last week has it. And then they also just got exposed at school. How do we know which one it was exposed? There's a lot of cross-pollination of that, and it's very difficult. We just take it and put it on our school one, even though we're not 100% sure it's ours. So it's not going to be 100% science anyway.
Yeah, there
and I'll just
seems
be
to
honest
be-
with you, when we started this, we were doing everything we can to keep up with contact tracing.
Sure.
I mean, our poor nurses work
Right.
all weekend, all holiday, and they are the ones inputting this information. They're overloaded. They're overloaded.
And I don't mean to sound critical. I think my point is this, and you said it, it's extremely difficult to
It
contact
is.
trace.
It is.
It's just, there's so many variables, there's so many layers.
It
There's
is.
a lot of bias involved, and there's a lot of factors that
Yes.
make it difficult, and it's extremely time consuming.
It is. Yeah.
So, thank you.
And I'm happy to see that the health department's acknowledging that by saying we're not going to contact trace from day 6 to 10 because we're drowning trying to contact trace. And I think they've done an excellent job, and I think we've done better than a lot of school divisions that we've talked to, that some of them have just given up on some of it. But I think they've worked really hard to do that, and I think it shows in our numbers. And we're not shutting down classrooms, and there's very little transmission happening in our classrooms.
Anybody else?
All right.
Thank you, Dr. Stigall.
Yes.
2022 is going to be a great year, a lot better than the last couple of years, for sure. So I'd like to take us back in time to March 2019, when COVID arrived on our doorsteps and the whole world turned upside down. We were told we needed 2 weeks to slow the spread, and here at Roanoke County Public Schools, we obliged and we pivoted and we did our very best. First we were told to mask, and then we were told double mask, no mask. If you get vaccinated, you don't have to wear a mask. And then the goalposts moved quite a bit, and then we were told to put our masks back on. If you went into a restaurant over the summer, you could walk into a restaurant, you have your mask on, you sit down, you could take your mask off because COVID magically disappeared when you were sitting down. And I'm sure you remember churches were closed, but bars were open. So it's been a little chaotic. We had a great summer, and then HB 1303 came into play, and it seemed like a great piece of legislation. I still think it was meant to keep our kids in school 5 days a week, and I think that was great, and in-person learning. But it became apparent that Dr. Oliver, with the VDH and Mr. Northam, they inserted their interpretation of HB 1303, making it a public health order, and things kind of changed. Everybody was really surprised that was put into place. So to be clear, the CDC is not a fourth branch of government. We have 3 branches of government. If we go back to our 8th grade civics class, legislative, executive, and judicial, and the CDC is actually a 501(c)(3). If you peeked into many of our classrooms this past semester, I can say from my own experience, the masks that were being worn were not being worn how the medical field typically wears masks. I've worked in hospitals for many years, and I can tell you I never wore my mask under my nose, I never wore my mask under my chin, I never wore my mask on my elbow, and I sure would never take my mask and put it in my pocket and then put it back on my face. I would also never pull down my mask to talk to somebody, and I would never pull down my mask to sneeze. And I think we've all seen this taking place. The psychological damage that we've seen our students go through and our children these past 2 years is really, truly beyond our comprehension at this point. We have a worldwide epidemic of suicides that's irrefutable, and we have a huge surge in drug abuse among our adolescents. A recent study came out of Brown University, and it's actually a really good one. If you haven't looked at it, you should. And it demonstrates a demonstrable drop in IQ of 21, 23 points. And they're attributing this to the result of masking and in daycares and schools. Brown University is not a university that anybody should sneeze at. We have passionate people on both sides of the aisle. We've got people that, parents that want to mask their children, and then we've got parents that don't. I support each one of the parents that want to mask and those that don't. If you want to mask, you should be able to mask. And in fact, you can wear as many masks as you want. If you want to wear a KN95 or an N95 or just a surgical mask, I'm not going to say that's up to you. But if you don't, you shouldn't have to. One person should not be able to choose for the next person. I don't think anyone should take away anyone's right to mask, nor I believe that any one person should take away someone's right not to mask. So if you go to the Code of Virginia, 1-240.1, rights of parents, this is what it is, and I quote, "A parent has the fundamental right to make decisions concerning the upbringing, education, and care of the parent's child." I'll read that again, 1-240.1. A parent has a fundamental right to make decisions concerning the upbringing, education, and care of the parent's child. Now, November 2nd, 2021, it was a big day for the state of Virginia. The people spoke. Governor Youngkin was elected. And that's because parents believe they absolutely have a stake and they're stakeholders in their children's education and that they should have a choice. January 15th, just coming up around the corner, 2022, Youngkin and his administration will take office. And his administration has made it very clear. He plans to give the control back to the localities. That's your local school boards. And he will appoint a new Virginia Health Commissioner. That's essentially your VDH guy. So today, I would like to make a motion, and my motion would be this, and is this: upon Governor-elect Youngkin's administration's canceling of the current VDH public health order, Roanoke County Public Schools will immediately become mask optional and return to pre-COVID medical policies, leaving medical decisions such as testing, quarantining, and contact tracing between the doctor and their student patient and students' parents and guardians. I should also state that federal law, you had it up there earlier, Rhonda, still will require teachers and staff to mask, because that's federal law versus state law, and also masking will be required on school buses and transportation. But just before anybody gets too upset about that, Virginia is a medical and religious exemption state. So that would mean that staff could file a medical or religious exemption form if they wish. So I'll read my motion one more time. Upon Governor-elect Youngkin's administration's canceling of the current VDH public health order, Roanoke County Public Schools will immediately become mask optional and return to pre-COVID medical policies, leaving medical decisions such as testing, quarantining, contact tracing between the doctor and the student patient or the student's parent and guardian. Do I have a second for the motion?
Any discussion?
You need a second first.
We need a second?
Yeah, I'll second the motion. I think that thus far we've relied on the state's guidance, and if their guidance changes, I think that we need to change as well.
And now we can have discussion.
Now we can have discussion.
Mr. Greenway?
So I may have misunderstood this, but I thought we were moving the meeting to the 18th to vote on this. Did I misunderstand that?
It can become an action item on the agenda for the 18th.
It'll become an action item for the 18th. Is that what you're saying?
No.
Okay, well, then that discussion that we had, I guess I just want to know, I didn't understand that then. You need to, so you're asking to vote it right now?
I was thinking that we would have some citizen input. We'd be able to talk to legal counsel and ask some questions, and then have the vote. like you were thinking?
Well, I'm honestly let's just be honest. You know, once the governor states what he states and gives it back to us, obviously I've been mask, optional from the beginning. I just think we're that close to the goalpost to let him speak, and then we voted in. That's why I thought you moved the meeting. That's what we discussed. But I'm just one person.
It would be, I do think it would be obviously helpful to get as much input as we can and legal input from our council, but I think everybody probably knows where I stand on this as well. And if people want to wear a mask, great. If they want to wear 2 masks, fantastic. If they, and encourage people to do that if that's what they want, but
See, my thought
typically.
was if we could, we know on good authority that Governor-elect Youngkin, January 15th is inaugurated, and he will more than likely make a statement. If you pay attention, you watch his inauguration, he'll write an executive order which cancels out HB 1303.
And
It
at
will
that
not be a
point,
legal issue. Right, so this motion is when and if he does that, effective of that, we would move forward, so that we don't have to come back for another meeting, so that we don't have to,
But we're gonna meet anyway.
And, yeah, we're gonna meet anyway, and that would, what if he delayed it, you know?
he's not gonna delay it, but that,
I
if he
mean,
does
really,
delay it,
yeah.
Mike, if he does delay it, it's delayed as well, because it's tied to him. It's tied to him. This gives parents, this gives people time, this gives us time to put together Q&A information,
But-
this gives people time to prepare.
But I was thinking, like Tim was thinking, that we would do the action on that night, where we would have we would have citizen input, we would have information that we could ask our attorney, and try to.
Yeah, if we were at the beginning of August like we were, I get it. I still think that way, but we're at the finish line. That's my only consideration, is that we're there, we let the governor, do
But what's
it.
the difference if you have the motion that coincides with him saying it? That's what the motion is.
Well, as long as we vote on it Tuesday, the 18th. I mean, now, if you vote tonight, I mean.
What's the
vote-
difference?
It would already be done, right?
I think you get the cover of the governor on that date.
Well, if the governor doesn't make it
Again,
official.
if we
That
were
would be
6
prior to us
months,
getting
we're only 2
anything
weeks,
from
or a
legal
week and
or
a half.
letting the citizens come too.
Well, the citizens been talking for a long time.
Yeah.
I don't think that we're gonna get a difference in opinion on either side, on the citizen part.
I just feel the opportunity to give them, and that we're doing something in a work session when we're not even giving them an opportunity for citizens, whichever way, I'm not saying whichever way they go, but I'm just saying, give them the opportunity.
And I've been beat down on this for 2 years, so I get, it's not, a movement away, it's a movement of just, what's a week and a half. But, by the same token, to Mike's point, transparent, it's not gonna change anything, right? I think from my constituents, I know where they stand. But, giving them the opportunity and transparency, the opportunity to speak is, they're gonna speak either way on that meeting night, right? So, yeah, I come back, I'll look to you, you're the chairman, so, and I don't mean that, but I thought that was already worked out, through what we had.
Well,
messaged. So I hadn't spoke to y'all.
The 18th, if he does make that effective on the 15th, the 18th, we're looking at one school day of masking or unmasking, being that the 18th that day, before we meet that night. Is it worth, I think we know what the decision will probably be come the 18th. Whether or not, because of Omicron and the surge in cases, I don't anticipate the new governor backtracking on that. I suppose it's possible. And it could be the 31st of the month, or it could be sometime in February before he removes that. I doubt that's gonna be the case.
I doubt it either, but I am cynical with politicians. Y'all know that. Y'all know.
If he did not rescind, you just go to any reports, he says he's doing it. So why not let the people know that this is what we're doing, or we will be mask optional, this is what he wants to give the power back to the people. This is what he said from the very beginning. So we know it's gonna happen. And the question, if you wanna say the question is when, it's gonna be 1:15, should be 1:15. I have that on pretty good authority.
And I agree. I don't doubt you. I have no reason to doubt you.
So if we're gonna do it anyway, much to the chagrin of 10% of the population probably.
From a legal standpoint, what kind of hurdles might you see?
Yeah, and I'm not your attorney, I'll say that. But I would say, just, by way of observation, in terms of what I heard the motion to be in the discussion, you've got two things at play, just as a reminder. You've got the public health order, which is one thing, which is just about masking. And then you've got the state law, which is Senate Bill 1303, which requires school boards to adhere to CDC guidelines. So I heard the motion being when he repeals the public health order, but then I also heard something about if he repeals 1303. So I think you need to clarify that because all of this also calls into question the quarantining and everything else. So I think you need to be clear in terms of what you're talking about.
Let me make it real clear. I'm gonna put it back to you guys. I'm gonna vote no today, but I'll vote yes Tuesday, the 18th. That's just where I'm at. We're that close to the finish line. Let's cross it.
Again, the motion is to coincide with what the governor does.
Any other? All right,
Motion, you got a second?
Madam Clerk, the roll?
Mr. Greenway,
No.
Mrs. Shawnee,
Yes.
Mr. Ray,
No.
Mr. Hudson,
Yes.
Mr. Linder.
Yes. All right. I don't believe there's anything else on the agenda. We've got a meeting next Tuesday with the Board of Supervisors at 5 o'clock. So until then, meeting adjourned.